Hi guys, welcome back. So today I decided to cover with you the basics of first aid for self-harm, especially self-harm cuts. We're doing cuts today. I may do burns and all of that in another video. Please tell me if you want to see another video on other forms of self-harm. But today we're doing cuts. This was a kind of hard video to script for because I'm not a medical professional at all. So this is all based on information you can find on the NHS website, the National Health Services in the UK. So yeah, please just note that I'm not a medical professional and that if the advice I'm giving you right now is not specific enough, then I can't give you any more. You need to go to your own health professionals. Of course, all the links to the sources are down in the description box if you want to go check them out. Thank you to the NHS for giving out such great information that is easily accessible online. I think this is a very great thing. But of course, first off, a disclaimer, like always. So I could understand why people think this is not a great video idea to make, because it might encourage people to self-harm or make it seem like self-harm is not a big deal because hey, you just need to take good care of it and it's not really an issue, is it? But this is really not why I'm doing this video. People are gonna self-harm no matter what you do, and sometimes the only thing you can do is harm reduction. Some are gonna self-harm. The best we can do is teach them how not to get an infection, how not to get too bad scarring. People are gonna self-harm and that really sucks. But if we want to help them, one other thing that is very, very important to do is harm reduction and teaching them how to take care of their wounds and how not to get an infection. If they can't stop self-harming or they have a relapse or anything like that, the best we can do is teach them how to take care of those cuts and how to not get an infection and basically reduce, I don't think we can eliminate them, but reduce all the health risks associated with self-harm. Of course, therapy is very, very important. I'm a huge advocate for therapy, and the best is just not to self-harm, but when you do, you need to know how to take care of those cuts. So that's why I'm making this video. Okay, so when taking care of self-harm cuts, there's basically 4 main points. First, stop the bleeding. 2, clean the wound. 3, put a dressing on. And 4, know when you need medical attention. So first step is stopping the bleeding. So for that you want to apply pressure to the wound with something clean. Sterile is best, but you probably don't have sterile things around, so something clean, dry and absorbent. Take that and put that on a wound, apply pressure, constant pressure for 10 minutes. And I mean constant pressure. Don't put it on and then take it off to see if it's still bleeding and put it back on and off and on. Just don't look at it, just apply constant pressure for 10 minutes. If the injury is on an extremity or something like your arms or your legs, one thing you can do if you're having trouble controlling the bleeding is you can raise that part of your body above your heart. So for example, if it's on your leg, what you can do is lie down and then elevate your leg. Now that you've stopped the bleeding, second stage is to clean it. This is a very important step to prevent infections and all things like that. First, you need of course to wash your hands thoroughly and dry them well. Then to clean the wound, you can either use tap water, so drinking quality water, or you can take any non-alcoholic solution like a saline solution or something like betadine, something that has no alcohol in it. So no rubbing alcohol, no hydrogen peroxide, no hand sanitizer gel, nothing like that. The problem with those is that it's way too harsh and you're probably gonna damage your cells around it and the tissue around the wound, and it's gonna slow down the healing quite a bit. And also it's gonna be super painful. So something gentle. If you don't have something available like a disinfectant spray or something like that, just use tap water. Then once you've cleaned it, pat it dry with something, again, sterile is best, so a sterile compress or something like that. If you don't have anything sterile, just something clean like a towel or a paper tissue or something like that. Just pat it down dry, very smoothly and very dry. Just make sure to not use something fluffy like a cotton ball or something like that, because some strands could get caught in the wound and that's really not good. So again, if you're really in a pinch, something like toilet paper can be very good, or something like paper tissue or something like that, but no fluffy cotton balls. So now that the wound is clean, you need to apply your dressing. This is very, very important, again, for infection risks or something like that. Basically, your skin is a built-in defense system against bacteria and all things like that from entering your body. But now that defense has been damaged, so you need to put a temporary defense on it so it doesn't get nasty. So this part is really not that difficult. It's just about finding the right type of dressing for your wound. Especially if you have several wounds on the same place, which can happen with self-harm, you need to find something that is large enough to cover the whole area that is wounded. So there's many different types. You can find adhesive ones like plasters, or you can find something non-adhesive, something like a sterile compress that you put on and then you secure in place with a bandage. You can also find them in different shapes, and some will be waterproof and some won't be. So which one you should choose will vary a lot depending on your own situation. If you're not sure, go to a pharmacy and they will be able to help you. I know that bandages can get very expensive when you're self-harmer, so maybe try to go to a dollar store or something like that if you have one in your area. They usually have first aid stuff that can be way cheaper. So that dressing that you will have chosen should stay dry and clean. So every time it gets wet or it gets dirty, you need to replace it, which basically means you're probably gonna have to replace it either every day or every couple of days. And once the wound is closed or has a decent scab on it, you can take off the dressing. And now for the last part, when do you need medical attention? The first reason would be if the 10 minutes of constant pressure didn't work and it's still bleeding afterwards. Then you need to seek medical attention. If you're bleeding from an artery, so if the blood that's coming out is pulsating with your heartbeat, this is something you definitely need to get checked out ASAP. This is very dangerous. If something is stuck in the wound, this is something you should not try to fix yourself. This is something that a medical professional should try to get out. If it is long or deep, you might need stitches. I know this is a very broad reason, because what is deep, what is long? I really couldn't find more specific guidelines, like if it's more than 2 millimeters wide, you need stitches. If it's more than, I don't know, 10 centimeters long, you need stitches. This is apparently something that is very based on the case-by-case situation. I know I really didn't know when I should get stitches sometimes, and I wasn't sure and all of that. So I'm sorry, I can't give you more information than that. But basically, if after the 10 minutes of pressure the edges of the wound are not together and they're still kind of apart, or if you can see any underlying structures under your skin, so anything like fat, bone, muscle, you probably need stitches. Another reason you should seek medical attention is if you have any sign of infection. Some classical signs of infections are fever, swollen lymph nodes, pus coming out, or if you have significant or worsening pain, redness and swelling around the wound. An infection can be very serious, so this is not something you should be taken lightly. And lastly, you should definitely seek medical attention if anything else seems wrong or seems a bit odd. If you're losing sensation in the area you've cut, if you feel very dizzy, if you feel faint, if anything like that is going on, you definitely need medical attention. Call the doctor, call an ambulance, call the ER, and if you have any doubt on whether you should seek medical attention, then definitely seek medical attention. You can go to your doctor, you can go to your hospital, you can go to the emergency room, you can go into a pharmacy to ask them for their opinion, you can go to your school nurse, you can go to a free walk-in clinic if you have one of those, you can call a doctor's hotline if you have one in your area. I know we do this in Switzerland, I don't know if anyone else has it. Just do something, and it's really not worth it having all those risks. I know it can be very scary asking for help for your self-harm wounds, but it is so worth it. I promise. Please seek medical attention if you think you need it. Even if you're not sure, just ask. So that's almost it for this video. The last point that you should think about is tetanus. Tetanus is an infection that you can get from wounds and from rust and from a bunch of things. You probably were vaccinated against tetanus as a kid. I actually was. Most kids are. But this is just something to keep in mind if you know you haven't been fully vaccinated. Tetanus is very serious. It is an incurable disease, so please make sure you're vaccinated. I hope I won't get anti-vaxxers in my comments. That would be a first. But yeah, just check if you've been vaccinated for tetanus, because this is just really not worth it. You probably were, but just check. Okay, so that's it for this video. I will leave the resume of all I've said in the description, so you can just go watch it. You can screenshot it, you can send it to others, you can save it, you can do what you want. So all the information I've just said will be in the description box. If you want me to do the same video for burns or for any types of self-harm, I would gladly do so. Please just tell me in the comments and I will do it. And of course, if you are a medical professional and you think I said something wrong in this video, please leave a comment. Please reach out to me on Instagram or something like that so I can correct what I just said. So that's gonna be it for this video. As usual, if you want to chat with me or you want to see daily content from me, please hit me up on Instagram. Link is in the description. As always, I answer to every DM I get, and I will see you very soon. Bye guys.